Hey everybody, my name is Dr. Christina O'Brien and I'm a clinical educator at Precision Analytical, and today we're going to talk about intermittent fasting and women's hormones, and we're going to take a look at a case study. For a disclaimer, any information presented today is intended to be utilized for learning purposes only and is in no way intended for treatment and should not be treated as medical advice. So a little bit of information about the patient we're going to be discussing. This is a 50-year-old perimenopausal female with a history of Hashimoto's. She has been gluten and dairy free for 15 years, and she started to notice some weight gain and difficulty losing weight perimenopausally, started waking up most nights, having more anxiety, and an overall feeling of low energy. So when she saw her provider, they decided that they would try intermittent fasting, and they had done, which I'm really grateful for, a before Dutch test and an after Dutch test. So we'll be able to look at the results in real life of what happened to a perimenopausal female. So there are lots of types of intermittent fasting. This is not even an exhaustive list of all the different types of intermittent fasting. One is 12 and 12, which is probably the most common for humans in general, naturally, at least in the United States. 12 and 12 is a really natural rhythm for intermittent fasting. 16 and 8 is one that's really commonly used and probably most commonly represented in the literature. 5 and 2 is actually the number of days in the week. So 5 days eating and 2 days fasting. Some people will choose 2 days during the week to fast. Then there's 24-hour, which some people use as an every other day fast. So essentially dinner to dinner in one day. OMAD is 1 meal per day. Acronym, and that's eating essentially 1 meal and no other snacks during the day, typically eaten at dinner time for cultural reasons. There's a protein fast. We also talk about a circadian rhythm fast later in the talk. And then there's the fasting mimicking diet, which Walter Longo really did the research on and perfected. The fasting mimicking diet, essentially, it's the ability to eat food and your body still thinks that you're fasting. Similar to this protein fast, where less than 15 grams of protein from all sources, including vegetables, is consumed. And the reason for the protein fast is that without eating protein, it counts as fasting. So there are lots of benefits in the literature for intermittent fasting. The focus essentially for intermittent fasting is about timing and not which foods to eat, which can create a challenge similar to the keto diet, which we will briefly talk about here in a few minutes, where you can eat everything from butter and bacon to just higher fat avocados and oils and meats, etc. Very different approaches to that diet. So some benefits are autophagy, which is great for cognitive health, longevity, immunity, inflammation. It's essentially when the body cleans out old cells and gets rid of them. Weight loss actually can carry over. There's a carryover effect seen in the literature by as much as about 20% of calorie reduction on eating days. So 20% of carryover in terms of weight loss. Healthy cholesterol levels, especially triglycerides, increased fat burning, cognitive health, longevity, blood sugar, specifically insulin resistance and type 2 diabetes, immunity, inflammation. It can modulate the stress response, which we'll talk about at length throughout the talk, increases NAD+, reduces oxidative stress, helps the microbiome heal, and can increase stem cell production. One thing I wanted to mention about inflammation before we move on is I found a study as I was researching for our talk and found some information that inflammation, this is a university in London did this research showing that social isolation increased C-reactive protein. which is a protein that's made in the liver, which shows up usually after injury and also increases fibrinogen, which promotes blood clotting. And I found that really fascinating with our recent cultural experience with COVID and the amount of isolation that people experienced in general during those number of years. So ketosis is when the body uses an alternate source of fuel. Ketones become fuel for the body. And ketosis and ketones in the body are like a mini alarm bell for the brain. So it makes you more alert. And what can happen in some people who are fasting is that they end up waking up in the middle of the night because they're in ketosis and their body's not used to it. So we'll talk about easy approaches to intermittent fasting and how to really take it slow and steady, easing in. And then fasting really is eating no protein, or essentially very little protein, 15 grams or less per day. Ketones also stimulate CCK, which is the hormone in our body that tells us to stop eating. And off ghrelin, which is our hunger hormone. So ketones can be very helpful in moderation. And as people are starting to fast, we recommend, as a provider, I recommend to my patients that they test their urine for ketones to make sure they're not getting excessive with their ketosis and potentially causing hormone disruption. So some of the main hormones affected by intermittent fasting are insulin, leptin, ghrelin, growth hormone, sex hormones, adrenal hormones, and thyroid hormones. We'll talk about each of those next. So intermittent fasting has been shown in the literature really extensively to improve insulin sensitivity and decrease insulin levels in the body. Did some interesting things to women's glucose levels in one study, which I'll share with you a little bit later. Leptin is the main satiety hormone. It's secreted by fat cells in the body, and since intermittent fasting helps with fat loss, it also improves leptin sensitivity, kind of like insulin sensitivity. So when we're eating and we keep eating, we store our food for later as fat, and our fat cells get enlarged. And leptin is what tells us to stop eating. So leptin secreted by fat cells tells us essentially to stop eating. So when we have leptin resistance, similar to insulin resistance, where it causes lots of dysregulation, instead of feeling not hungry anymore, we are even hungrier over time. So intermittent fasting has been shown to help this whole process. Ghrelin is the hunger hormone. People who are overweight and obese in the literature have lower levels of ghrelin after a meal. Fasting decreases ghrelin, and the level of this hormone drops down after a meal. So an imbalance in this hormone is associated with higher food intake, which is linked to overweight and obesity. So growth hormone in intermittent fasting, human growth hormone is really tightly regulated to insulin regulation. And as insulin levels go up, human growth hormone secretion decreases and vice versa. So human growth hormone is only released when there's no insulin in the bloodstream, and this happens when we're fasting, which is how growth hormone is linked to intermittent fasting. The body is most sensitive to insulin following a fast. And the more sensitive you are to insulin, the more growth hormone your body is able to secrete. So some side effects, some not so great side effects of intermittent fasting that we see in the literature are binge eating, metabolic disruption, lost menstrual periods, early onset menopause, and a lack of ovulation. So key hormones, which regulate key functions like ovulation, metabolism, and even mood, are really sensitively tied to energy intake, especially in women, it turns out. So not only changing when we eat, but also how much we eat can really shift our hormones in one direction or another. So we always want to use caution before starting intermittent fasting in people with eating disorders. any kind of sleep disturbance, adrenal dysfunction, a low blood sugar or diabetes, weight gain, difficulty and malnutrition, PMS, fibroids, endometriosis. We'll see some interesting evidence that it really does help with women with PCOS in particular. Recent surgery where the body really needs to recover, POTS or any other electrolyte imbalance issues, and any type of chronic disease in general, especially if people are on medications. It's advised to always discuss with your doctor before starting a program like intermittent fasting in any way. Absolute avoidance of intermittent fasting should be practiced by people who are pregnant or breastfeeding, people with a history of lack of cycles, amenorrhea, infertility, or who are not ovulating, and people who are under an extreme amount of stress or have HPA axis dysregulation. We'll talk about the HPA axis as we move through and see that there is some benefit to fasting on the HPA axis, especially in our case study, but it needs to be approached very cautiously and with your doctor's help. So I wanted to just show a quick reminder for everybody of the menstrual cycle. We're going to talk about all of these hormones and then at length about exercise and food related to the menstrual cycle. So here, estrogen and progesterone are low. This is menstruation where hormones really flatten out. The follicular phase is when estrogen and progesterone start to rise. Ovulation is when estrogen peaks and testosterone and progesterone begin to rise. Really, there's only one little blip in testosterone essentially in the cycle, and that's around ovulation. And then the luteal phase is when estrogen and progesterone levels are high. If the egg isn't fertilized at that point, then menstruation starts again. So there's a considerable lowering of the hormones in this period. Very similar to menopause, where typically levels are really low of estrogen, progesterone, and even eventually testosterone. And we'll talk about that related to intermittent fasting as well. So the HPG axis is the hypothalamic pituitary gonadal axis. In women, LH and FSH stimulate the production of estrogen and progesterone, which we need to release a mature egg, which is ovulation, and to support pregnancy. In men, it's releasing testosterone, the production of testosterone and sperm production as well. And because this chain of events that we could see here happens in a very specific regular cycle in women, GnRH typically pulses in women throughout the cycle. The big takeaway from all of this is that these pulses in GnRH tend to be very sensitive to energy and energy intake, environmental factors, over-exercising, under-consuming of calories, etc. So even in short-term fasting in the literature, even 3 days of fasting has been shown to throw off GnRH pulses in cycling females. And this is part of the reason why some women start to have problems with intermittent fasting. And kisspeptin is something else we'll talk about, especially related to PCOS, but animal studies in particular show that this decreases during fasting, which has the ability, again, this is an animal study, ability to turn off estrogen and progesterone production. So we want to keep all of this in mind when we're considering intermittent fasting in general. So hormesis is a word for a stressor on the body and the body's reaction to that stressor. So some stress is good for us. Our bodies want to be under stress to a point, but women tend to be particularly sensitive to stress, especially cycling females. The hypothalamus actually turns down production of reproductive hormones necessary for ovulation and menstruation when under stress, usually extreme stress, but it could be any kind of stress, even perceived stress. So some stress is good. Too much stress, not so good. And this is where sometimes people see really great benefit from intermittent fasting initially, but then it turns out to be too much of a stressor on the body. It's like doing too much HIIT exercise rather than just movement can cause stress and unnecessary stress on the body. So there was a large literature review. This was in 2022, June of this year, that really tried to get comprehensive and look at most of the literature to date as of June on intermittent fasting. And most food is eaten before 4 p.m. They found in this review that there was no effect on estrogen, gonadotropins, or prolactin level. They did find, however, that it decreased androgen markers, specifically testosterone levels in lean, physically active young males, but did not affect muscle mass and muscular strength in that review, but it increased sex hormone binding globulin. So some interesting findings about androgens, and we'll see that this is pretty consistent throughout the literature we're going to review in our talk today. So too much of a good thing. Stress, diet, exercise, psychological stress can also damage hormonal health. Our bodies can't tell the difference between a real threat and a perceived threat. That's an evolutionary protective mechanism that we have. And these threats can increase our cortisol initially and then for the long term. So we're going to look closely at women's hormones and intermittent fasting as we move through. As we mentioned, women's bodies are quite sensitive to a lack of nutrients. And if done correctly and eating the right nutrition can be helpful, specifically in women with PCOS. That's really the most consistent literature showing that PCOS shows great improvement with intermittent fasting. Some possible hormone reactions, and this is where we need to be careful. We used to think that it really was about body fat percentage, and then when body fat percentage decreased to less than 11%, people would stop cycling. But now we know that even low calorie intake or over exercising does the same thing. So if any of these things start to happen, any of these negative things show up, your hair falls out more, you get more moody, change in metabolism, digestion, sleep problems, irregular period, or always feeling like you're cold are probably signs to take a break from intermittent fasting. So there was a PCOS study done in 2018, which showed great benefit related to kisspeptin and LH pulses in this PCOS group. So some really significant benefit from intermittent fasting. And this is essentially the mechanism that kisspeptin uses here to make changes in women's bodies with PCOS. So a study looked at 15 women, not a huge number, but 15 women over 6 weeks. They did a 16-to-8 fast, the most commonly studied type of intermittent fast, and they showed an improvement in menstruation, insulin resistance, chronic inflammation, weight, and body fat. So it was, even though it was only a small study, only 15 women, it's worth noting that 70% of women noticed improvement in menstruation. And this is in women with PCOS who tend to have really irregular cycles, and they have really the most to gain from intermittent fasting from this perspective. Restricting proteins, specifically amino acids, can impact estrogen receptors and IGF-1, which means that low protein diets have the potential to reduce fertility. And estrogen in general is important for the bones and the heart, important related to insulin, which is why women in perimenopause and menopause tend to develop insulin sensitivity more commonly because estrogen levels drop. Body fat tends to increase, metabolism tends to slow down, sleep and energy tend to change, cognitive function may change, and mood, anxiety, and stress also change with estrogen fluctuations. Athletes who experience amenorrhea typically do so because of low estrogen levels. Same with low calorie consumption. People with eating disorders tend to have lower estrogen levels. So some signs and symptoms of estrogen imbalance here on this page, on this slide, we see low energy, poor glucose control, very similar to what we just talked about. We also have estrogen receptors throughout our body, including in our brains, our gut, in our bones. And this is why we want, especially when we're looking at the Dutch test, and we look at the E2 dial in particular, we see that there are 2 stars, and the premenopausal range is in between those stars, and the postmenopausal range is that little purple rectangle at the bottom left-hand side of that gauge. And then there's a gap, that sweet spot where the literature shows us that E2 is most beneficial postmenopausally in order for bone and heart protection. So that's part of what we really use the Dutch test for, monitoring bioidentical hormone replacement therapy in particular. It's a terrific way to do that. This study was really fascinating. Approximately 75% of all breast cancers express estrogen and progesterone receptors. And therapy is usually effective in these hormone-positive tumors. Really endocrine therapy, tamoxifen, especially, I think, is most commonly used. And this was in a mouse model. Hormone receptor positive breast cancer reduced or regressed after a period of a fasting mimicking diet, which isn't even true complete fasting, but the body thinks it's fasting in general. So this was really promising. Again, a small-ish study, but a promising study for estrogen and progesterone positive cancers. And DHEA, this is a very new study. DHEA is a hormone made in the adrenals. DHEA, acetylcholinone, and androsterone are all downstream metabolites of DHEA. It's a hormone made in the adrenals. And this study found that there was a decrease in DHEA after 8 weeks of time-restricted eating in both premenopausal, postmenopausal females and in men. So this study found that testosterone levels didn't change in the females in any group, but DHEA decreased. So a slight difference from the study we talked about before, and we'll look at that when we look at the case study. And they only measured in the study estrogen and progesterone in the postmenopausal women. Part of why I think there's not a whole lot of research on premenopausal women is their hormones fluctuate so greatly that it's harder to create a study that will be statistically significant when we're looking at that large amount of hormone fluctuation. But in this study, in the postmenopausal women, there was no change in estrogen or progesterone, but definitely a change in DHEA, which is related to adrenal health. So cortisol, also like ketones, acts like an alarm. If somebody's waking up in the middle of the night, especially at first, adding in carbohydrates can be helpful. A low cortisol level is much worse than a high cortisol level. If we don't have enough cortisol, it's harder to maintain our blood pressure and blood volume. It's harder to control inflammation, harder for our body to make energy. If there's a lack of energy, typically the body will pump out cortisol, same with blood sugar. So the body tends to wake up usually around 3 o'clock in the morning, which is most unfortunate. But if that happens to people who are fasting, some of the tricks, especially Dave Asprey talks about this in at least one of his books that I read, that a little bit of raw honey 3 hours before bed or even closer to bed can help prevent that 3 a.m. wake up. And using glasses, curtain screens, really following good sleep hygiene is helpful for cortisol. SCN is a suprachiasmatic nucleus where the eyes send messages to wake up, and that's the opposite of what we want at night. So some causes of HPA axis stress: a blood sugar dysregulation, an iron deficiency, a sluggish liver, a hypothyroid, especially an autoimmune thyroid, infection, obesity, poor sleep, inflammation, perceived stress, and hypertension. We're going to look at the differences between cortisol and cortisol upregulation and downregulation. So this is a graph that shows excess weight and morning cortisol depletion. So it's interesting that a normal cortisol curve is here, slightly overweight cortisol is here, and extremely overweight cortisol is here. We'll talk about what happens here as we look at the Dutch test, and we show an example of how this can happen. But there is clearly in the literature a lower morning cortisol, especially with overweight patients, especially extremely overweight patients. So some symptoms of cortisol dysregulation, there are a lot more than I listed here, but anxiety, low energy, insomnia, that wired but tired feeling, sugar cravings, metabolized cortisol is lower in patients who are intermittent fasting, and we'll talk about that too here in a second. There are a few phases of adrenal output of cortisol, what we used to call burnout or adrenal fatigue. We now talk about differently. And the more tests I see and reviews I do, the more I realize how wise the body is and how the body knows what it's doing as far as cortisol production, metabolism, etc. And you can spot using the Dutch test when the body is protecting itself and when the body is confused and is unable to do those things that it used to do. So this is an example of a hypercortisolism, and this is the bottom part of the Dutch test. And when we look at this, we're seeing here, we put these two dials at the bottom of page 1. This is one of my favorite parts of the test. We see the 24-hour free cortisol, and we see the metabolized cortisol. And we put these two dials next to one another in hopes that they'll tell us a bigger story regarding the activity of the HPA axis. And what we can see in this case is that there's a low 24-hour free cortisol. Then we move that cortisol peripherally and metabolize it. And we can see that there's a really clear speeding up of the metabolism of cortisol in this patient. This is typically what we would see in an obese patient. And when people with higher metabolized cortisol fast, their metabolized cortisol tends to lower, and this tends to regulate for them. Infection, inflammation, pain, blood sugar dysregulation, and hyperthyroid, autoimmune thyroid typically can cause this kind of presentation. And then we'll look at a hypocortisolism. This is where there's a lot of 24-hour free cortisol, and then when that cortisol is moved peripherally, there's a real slowing of the metabolism of cortisol, which tells us that there's a slow component to the patient's HPA axis. This is most commonly seen with a hypothyroid, especially with this big morning spike. Very typical of a hypothyroid pattern. The other things that we could see that can contribute to a hypocortisolism are iron deficiency, blood sugar dysregulation, and a sluggish liver. So we want to talk about how stress impacts the body, especially the adrenal glands. And this is a 2018 study of only 11 women, again, a really small study. They did a two-day fast, and they noted that there was an increase in their sympathetic nervous system activity. So not a lot of parasympathetic activity. I mean, that's part of what we look at when we're looking at the cortisol awakening response in the Dutch test. We want to see how is their body responding to the day. Is their parasympathetic nervous system activated, or are they staying in sympathetic mode, which is a constant stressor on the body? In 2005, obesity research, again, a small-ish study of 8 men and 8 women who fasted alternating days for 3 weeks. And this is where I mentioned earlier, very interesting response for women. There was slightly worse glucose tolerance and no change in insulin response in these women. Again, a really small study. You're noting a theme here probably where these studies are small and there are not a lot of them really yet conducted. I think we're starting to see more and more the more popular intermittent fasting and fasting in general becomes, but we still have a ways to go in learning about our body's true response to fasting. In animal studies in mice, this is from 2018 study, mice who fasted for 12 weeks and did intermittent fasting, not a full fast for 12 weeks, but intermittent fasting showed that they had smaller ovaries, more insomnia. And this started to show up after only 2 weeks of intermittent fasting, which is fascinating. That's really just getting started in intermittent fasting, and there was a big difference. Again, this is an animal model, but some interesting findings here. We also, when we're looking at thyroid, I'm going to show that in a later slide, but some thyroid hormone imbalance symptoms, and being cold, being drier, trouble regulating body temperature. You'll notice how similar those are to symptoms of, say, low estrogen, anxiety, brain fog, weight gain, very similar symptoms. To when estrogen is low, which is another really, I think, important reason, especially for cycling females, perimenopausal females, and even really menopausal females to use something like the Dutch test, where you really can quantify the amount of hormone in the body and see some signs potentially that thyroid could be imbalanced as well. Of course, looking at thyroid hormone itself is done in serum. So perimenopause is a really tricky time, and there's not a lot of data on perimenopausal females, which is why I decided to do a case study there so we could look at and see what happens to a real person when they actually fast. Again, a really small sample size of 1, but still some interesting information. So fasting in perimenopause, hormones tend to shift. Month to month or within the month. Typically, we see higher estrogens and lower progesterone, although not always. And we want to see a fairly robust level of testosterone. The perimenopausal phase is really the time where women can store and feast before the famine of menopause. And that's where the question of intermittent fasting comes in. Really treating the body kindly and listening to the body is super important. So sleep is disrupted already, hair's falling out sometimes already, menstrual cycles irregular already. So if this person starts intermittent fasting and already is having these symptoms or sees those symptoms show up and they are perimenopausal, they may not know if it's related to perimenopause, a hormonal issue, or if it's related to intermittent fasting interfering with hormones in some way. So shorter intermittent fasting at first can be helpful, not intermittent fasting back to back if the patient is perimenopausal. Alcohol can make fasting even harder. Making sure to look at hormones and quantify them and follow them throughout time is really important, as well as looking at the thyroid. And we know that too much estrogen, not enough progesterone, makes weight loss more challenging. So here's our case study. This is what our 50-year-old perimenopausal female looked like before intermittent fasting. So there's a reduced cortisol awakening response here. We're waking to 30-minute and 30 to 60-minute. We're both much lower than we would expect. We want a typical cortisol awakening response to be here, and that that salivary component is overlying that diurnal pattern. So it gives us a lot of really good information about a patient's health. This is a person who doesn't have a very good response to the day, right? This is really a decreased cortisol awakening response in this patient. We're typically thinking about making sure they're getting good blood flow to their brain, making sure they're following good sleep hygiene. If you remember, this person is not sleeping very well and waking up most nights, which can contribute long-term to this lower cortisol awakening response. There's a hypercortisol pattern with this really low cortisol. There's a low-ish estrogen, a lowish progesterone, and a high level of testosterone for this patient's age. And then what we see here, this is a little dial. The fan gauges tend to be more of our summary sections on the Dutch test. And this patient, our case study, is holding on to more cortisol metabolites. So this is what is happening in this patient before trying intermittent fasting. So we want to remember these as we move through. So low normal estrogen, high testosterone. We also want to note that the DHEA for her age is within range. So then We're going to look at this chart that he found in the literature, and we could see this is during an acute fast. What is happening? This is illustrating essentially the relative levels of hormones during an acute fast. The dotted lines are an acute fast, a short fast. This is insulin here. During the fast, initially, insulin decreases. T3 can go up and then comes down a little bit, and cortisol initially climbs here. And we'll see with more elongated fasting exactly what happens. So when we look at long-term intermittent fasting, what we tend to see is that insulin levels are beautiful. This is where if somebody already has a hypoglycemia or a blood sugar dysregulation, they need to be very careful because insulin levels are going to consistently be lower. We see T3 consistently lower, which is a very interesting finding and something to be concerned about. T4 to T3 conversion, if we're looking at genetic markers, can turn into reverse T3 instead of T3 if there's a genetic mutation on the DIO1 or 2 gene. So we want to take note of this, where if somebody already with a hypothyroidism starts intermittent fasting, we can start to see some hormone dysregulation. I know that I've seen that in a lot of my female patients, especially the perimenopausal patients. All of a sudden their thyroid will start to get more dysregulated after extended or long-term intermittent fasting. And this is what happens to cortisol. So cortisol goes up and stays up after intermittent fasting, which could be a great idea for somebody like this who has really low cortisol and tends actually to have lower blood pressure. So this is what happened after intermittent fasting. So we could see that E2 was lower, was 1.34 before. Progesterone, she actually started taking progesterone. So this is not a natural level, not naturally elevated. And this is after 3 months of intermittent fasting, 16 to 8 every day. And testosterone decreased, which is what we have seen in the literature. And look at this beautiful cortisol awakening response. This is a great example of an increase in a cortisol pattern from the previous pattern in a 90-day time frame. This is a really amazing change here. And what we see is that there's a little bit of an improvement in this. This is not as extreme as before. And there are more cortisone metabolites in that fan gauge. So what intermittent fasting should do is it should lower metabolized cortisol by its effects on insulin sensitivity and the enhanced glucagon insulin balance, which directly decreases the 11-beta HSD1 expression, which decreases TNF alpha and IL-1B in adipose tissues. So as those go down, then 11-beta HSD1 expression also decreases, which is involved in converting more to THF rather than THE. So we could see the things that we saw in the literature and the expected changes are here, right? So did we want ET to go down in this patient? Probably not. In this patient, did we want testosterone to go down? That's okay. It was a little bit high before, but look at the DHEA. That one also decreased. It was 1,192 and decreased to 681, which is also consistent with what we saw in the literature. So this is a good example in this case study of how we need to take our patients' levels into account before we recommend intermittent fasting with them. Some real benefit can be seen, and this is where we can see, especially in women with PCOS who tend to have really high testosterone and higher levels of estrogen and cortisol dysregulation, with usually high DHEA as well, although not every time. Huge improvements with intermittent fasting. That's probably the population that does best, other than menopausal females. There's some interesting research, although not a ton of data. This is more anecdotal because hormones are more stable, similar to during menstruation, where hormone levels are low. there tends to be more opportunity for intermittent fasting in menopausal women, carefully, of course. Weight and insulin resistance increase in menopausal women. One meal a day actually works really well for some menopausal females, and it's important to watch estrogen levels really closely because estrogen levels around menopause, especially E2, tend to decrease. And these are the ones where when we look at the Dutch test and we look at this sweet spot right here between 0.7 and 1.8, it's important that estrogen remain here postmenopausally for bone and heart protection. So we want to make sure we're achieving that level and carefully monitor this in menopausal women who are trying intermittent fasting. So very little evidence on libido, but men, this was a study on men that I found who fasted during Ramadan had a decrease in libido and frequency of sexual activity, but there's very little data on women and libido regarding intermittent fasting. So sleep is hugely important. It's important that in order to heal and lose weight even, that sleep is as close to perfect as we can get it. If we can help people sleep, we can help with a whole lot of generally complaints and health conditions. So fasting at least 3 hours before bed. There's a study at University of California, San Diego, that showed that each 3-hour increase in the gap between the last meal and bedtime significantly reduced the odds of having an elevated blood sugar and also having elevated CRP. Circadian rhythm, really important. That rise and fall of cortisol that has an inverse relationship to melatonin, which is our nighttime hormone. Eating too close to bedtime tends to disrupt the circadian rhythm. A healthy sleep curve, and this can be really easily monitored with an Oura ring, which has been really helpful for a lot of my patients. You could use an Apple Watch or a Fitbit or a Whoop strap. There are lots of ways now to measure our sleep and biohack in many other ways in general. Having good eating patterns important, following a strict circadian rhythm schedule, exposing the body to full spectrum light first thing in the morning, a happy lamp or a hatch alarm for people, especially in the north part of the United States, very helpful, or north in general. No food after dark is a really neat way if you start looking at having good eating patterns around seasons. An ideal eating pattern would be looking at in the winter time, eating from maybe, in the evening more, and in the summertime, eating a little bit later, say 2 to 8, if you're going to do a 6-hour window, and follow the sun, which is how we used to, our circadian rhythm used to be set based on, really tightly set on the sun rising and setting, not so much anymore. We use screens and all sorts of things, work and stress and all the things that change our sleep schedule, travel and jet lag. Outside stimuli, blue light from screens can hugely disrupt the circadian rhythm. Late night snacking is a huge disruptor. Alcohol, huge disruptor. We know that roughly when it comes to sleep and sleep quality, light accounts for approximately 70% of that. Food, about 20%, and then temperature, about 10%. So circadian rhythm reset fast. I read about this in Dave Asprey's newest book. I thought this was really fascinating for people who have jet lag or have gotten themselves really dysregulated as far as circadian rhythm, waking at the same time, exposing that body to full spectrum light in the morning, eating a lot of protein right when you wake up, really within 30 minutes of waking up, having lunch with fats and grass-fed protein, fasting after 2, dimming the lights 2 hours before bed, and repeating for a week. There's some really impressive information on this in his book, and he's done some fascinating work on intermittent fasting and looking at how it impacts the body. he biohacked himself originally, I believe. So it's important when we're talking about intermittent fasting to use an individualized approach to improve hormonal health. It's really clear that we need more studies on intermittent fasting to really understand in the literature what it's exactly doing to our bodies, especially when there's a little bit of conflicting data in the literature. Some consistencies, but some conflicting as well. So it's important to start slowly, stretching the time between eating, waiting to eat longer in the morning. If you're unsure if intermittent fasting is the right thing for you, always reach out to your doctor. What works for someone, especially in perimenopause, one day or in one moment, may not work the next. And then watch for those symptoms that we talked about. Make sure that it's not dysregulating the menstrual cycle. For women using intermittent fasting, a good strategy is trying intermittent fasting every other day. Essentially not fasting for more than 12 or 13 hours, especially at first. Always intermittent fasting every single day sends a signal of starvation to the body, even at 16 and 8. So it's important to monitor the body's response, especially if you're still cycling. It's easy to monitor that. Not fasting during the week before the cycle or at ovulation, matching food and exercise with the cycle, also not doing high intensity activities, HIIT exercises, for example, on fasting days. So if someone's fasting every day of the week and they're working out, you'll see how easy it is to, forget or mistime things and really wear your body out on those days. So days not fasting, eating protein and fat in the morning, but no carbohydrates to keep things more stable. A full 24-hour fast once a week is possible for women in general, picking a low stress day, not eating breakfast, not eating lunch, but eating dinner, keeping things less aggressive, making sure that you have enough electrolytes, especially salt, and modifying if overweight or over 40, and replenishing the body with carbohydrates. Eating some carbohydrates every day or carb cycling can be really helpful. The literature shows even men can benefit from a carb refeeding day once a week in moderation. So foods to help balance the cycle. Different foods you can focus on if you are going to do intermittent fasting. These are some foods that are possibilities to help keep your cycle as even as possible, potentially. When on your cycle, eating mineral-rich foods can be helpful, especially leafy greens, beets, red meat, etc. Ovulation, brassicas can be helpful, broccoli sprouts, etc. During the luteal phase, things change, more fatigued and have more food cravings, and things like magnesium chocolate. Dark chocolate is high in magnesium and can be helpful right before the cycle in order to stave off food cravings. Eating a lot of healthy fats like avocado, nuts, seeds, coconut can be helpful. Seed cycling is also something that can be helpful in order to even out hormones and balance hormones in general. During the follicular phase, pumpkin seeds and flax seeds, and during the luteal phase, sesame and sunflower seeds, raw, about a tablespoon of each per day on those days can be helpful. Exercising according to the cycle, also according to intermittent fasting, really important to make sure that we are not overstressing the body. These are some supplements that could be helpful during intermittent fasting. Activated charcoal is something that can be helpful. Anti-inflammatories in general, adaptogens and mushrooms. Brain support like PQQ and Bacopa. B vitamins, vitamin C. Fat-soluble vitamins, electrolytes, really important. L-glutamine, fish oil, more brain support. Enzymes like Wob enzyme, proteolytic enzyme to help with calcifications in the body, essentially. In between meals is how those are taken. And then prebiotics and probiotics. And again, when you're looking at different supplements in general, I recommend always talking to your doctor. Measuring your levels of things is helpful before just starting on a regimen, and always get help and advice. There's lots of conflicting information out there about supplements, and it's helpful to get some advice from your doctor. Drinking water can be helpful when starting fasting, making sure you're not exercising too much, making sure you have plenty of food on hand, listening to your body, easing into fasting. Women usually can benefit from some carbohydrates like sweet potatoes, carrots, squash, even white rice, especially at dinner, to help keep their blood sugar stable throughout the night. This is something that Dave Asprey talks about. This goes sort of counter to the theory of using nuts and seeds. Again, there's a lot of different information out there about intermittent fasting and what is beneficial to the body, but there is some evidence that high oxalate foods like kale and spinach and sesame and chard can make fasting harder. Histamine can cause allergies and cravings. Phytic acid, burn meat, and lectins, although there are some enzymes now that are specifically lectin blockers if you're eating foods that are higher in lectins, like potatoes, tomatoes, beans, etc. Again, from Dave Asprey, some foods that, according to his research, may make you hungrier. Fruit juices, diet drinks, soda in general, powdered milk, gluten or hydrolyzed gluten, anything that is chemical, essentially, can make you hungrier in general. So a little summary on women and intermittent fasting. Out of the 71 articles, out of the 71 articles on intermittent fasting, only 13 included women. So there's a real need for more research, especially on women, cycling females, perimenopausal and menopausal females. We know that women are more sensitive to dietary change at the cellular level, and fasting too much can create stress response too quickly. So there's a really tight connection between the food supply, sex hormones, and fertility, which really makes sense from an evolutionary perspective. When there was fast, fertility tended to drop off. And the epigenetics of women in particular can help explain why daily intermittent fasting can pose a challenge. There are epigenetic changes that happen in addition to chemical changes that tell the body that there's a famine and not to reproduce. So things like sleeplessness, anxiety, adrenal insufficiency, irregular periods, even osteopenia and osteoporosis are possibilities. If intermittent fasting is done for an extended period, again, we really need a lot more research. Can be very beneficial for some people, but for some people, really not such a great idea. So when we're looking at the Dutch test, we want to make sure, especially in my practice, there is no set time frame for retesting for Dutch test, but I typically test the first time at the 3 to 4 month mark to make sure we're heading in the right direction, and really allow for treatment protocol efficacy. We want to make sure that we are accomplishing what our goals are, what our patients' goals are. Cycle mapping actually can, when we're looking at sex hormones, often even more comprehensive look at hormone variability throughout the cycle and help us to target foods throughout the cycle, and intermittent fasting even throughout the cycle potentially. Detoxification influences estrogen levels, and we can look at the metabolism of that in the Dutch test, which is fantastic. It gives us a way to know not only estrogen levels, but how the body is detoxifying and methylating those hormones, the estrogen especially. Androgen patterns can influence overall symptom presentation, and the Dutch test is a terrific way to measure hormone replacement therapy, bioidentical hormone replacement therapy. And when we look at adrenal hormones in the Dutch test, we want to make sure there's significant or sufficient DHEA production. Low metabolized cortisol versus high metabolized cortisol, very important to look at the difference for your patient. A cortisol or a cortisone preference systemically. The elevated nighttime free cortisol. There's also the ability to capture that in saliva or in urine on the Dutch test, and that can be really helpful if people are waking up at night and we want to know why. We can look at the cortisol and cortisone levels overnight to see what's happening in their body and see if that's causing an imbalance, potentially imbalanced diurnal pattern. So for our case study, overall test results showed before intermittent fasting, normal DHEA, higher estrogen, higher testosterone, and lower cortisol. And then after intermittent fasting, lower DHEA, lower estrogen, lower testosterone, and higher cortisol. So some of those things were desired in this patient, some not so desired, which is where measuring is important. And the adrenal glands become the second ovary in menopause. So adrenal health is really the foundational cornerstone for overall hormone balance and resilience. So the overall approach when looking at the Dutch test and reading the Dutch test, especially related to monitoring therapy and looking at pre and post testing, foundational principles with regard to sleep, stress, body movement, and blood sugar, and you can never add supplement to poor lifestyle. So it's important when looking at these results to keep all of those things in mind regarding your patient and your patient's health and how you can best help them as their provider. So thank you all very much for attending. It's an honor to have your time and attention today, and hopefully you learned a little something. I know I had a terrific time researching intermittent fasting and really learning a whole lot more about the research that's there, the research that's needed, and the impact it can have on women's hormones. So thank you all so much.